I'm Dr. Jagadeesh, PC, a senior consultant orthopedic surgeon, practicing orthopedics, general orthopedics, and trauma, arthroscopy, and replacements, which includes the knee replacement, shoulder replacement, as well as the hip replacement, and specialized in arthroscopy and sports medicine. Once the ligament reconstruction has been done, that is anterior cruciate ligament reconstruction has been done, the rehabilitation starts from the day one. Day one, we make them tell the isometric exercises, that is we make to tell them to strengthen the quadriceps muscle and the hamstrings when they are lying down. And from the second day, we will make them to bend the knee to a few certain degrees. From say around up to 30 degrees of the knee bending will be allowed. And this extend up to a period of 2 weeks. And associated with that, they will be doing an ice fermentation, putting the ice packs around the knee joint and strengthening exercises, and they will be able to walk using the crutches if there is no associated injury in the knee joint. That is only if the ACL ligament reconstruction has been done. Some patients, they will have an extra injuries. Apart from anterior cruciate ligament, they will have a meniscus injury, that is the small cartilage, that is the cushion-like cartilage which has been damaged, will be repaired. So these patients, they have to walk with a non-weight bearing, that is without putting the weight on the leg, they will be walking using the crutches. And this extend for a period of 6 weeks in these patients who has got a repair done, meniscal repair has been done. Otherwise, the anterior cruciate patient ligament itself, they will be walking after 15 days with full weight bearing walking. And from the 2 weeks to that is the 6 weeks, they will be using complete full weight bearing walking, and then they start their knee bending from 30 degree to 90 degrees. That is, they can sit in a chair with the folded, and gradually their knee bending goes on increasing every week, few 10 to 15 degrees in the increasing increments. So they will be attaining such a constant at a period where they can do the full bending, that is only after the 6 months. And regarding the staircase climbing, because most of the people, the first question they'll be asking, when we do a staircase climbing. Staircase climbing will be started from the second week, complete with the full weight, because when they start with the full weight, they have to start staircase climbing in the initially but a single steps a time, and then after 1 month, after 6 weeks, so they can able to walk continuously using their one leg and the other one continuously the staircase climbing or climb the stairs down. And this should be aided with the strengthening exercises, as always will be there apart from the knee bending and the things and all. And from the 6 weeks, the patients will be encouraged to go for swimming. Swimming activity is very important to build up the strengthening. So these are all where we call it as a closed chain exercises. Closed chain exercise where they will have a contact with the ground and do some strengthening exercises. And from the swimming, they are encouraged to go for a cycling. Stationary cycling will be always the best. Or if some people, if they are able to go out with this regular cycling, they are encouraged to go with the regular cycling. And strengthening of the muscles will be carried on along with that. And at the end of 2.5 to 3 months, they should go to the gym and start working the strengthening the muscles. So till the 3 months, they will be concentrating only on the flexion, they are the bending and flexibility and maintaining the muscle tone, that's all. But after the 3 months, they should start thinking about strengthening the muscles and getting the muscle bulk, which is very important. So from the 3 months, they should be able to join to the gym and start strengthening of the exercises, which will be graded, gradually will be increased, and the weight also will be gradually increased. And at the end of 6 months, they should be able to get the tone, the muscle, like a normal one. And at the end of 6 months, they will be trained to go for agility tests and all, where they can cope up with the stress which they undergo when they turn and all those activities will be taught to them. And at the end of 7 months, they should be able to jog and run and do any playing activities.